Do you know we as a country are leading in the number of cardiac deaths across the world, and do you know obesity is one of the leading causes of cardiac diseases? I am Dr. Lakshmi, bariatric and metabolic surgeon, Yashoda Hospitals, Hyderabad. As per the recent newspaper survey, we found that we are as a country leading in the number of cardiac deaths in the world, and almost most of them is caused because of the weight issues and various lifestyle disorders, and almost 20 to 25% of the urban population is obese. They have said that the present Indian families, most of the families are overweight to obese, including small children. So that is why we are seeing a surge in the number of diseases like heart problems, diabetes, lot of cancers linked with obesity in the rise, in spite of having the best of the medical services available at our easy reach. Almost every place, the big cities, the districts have reasonable good health care, but then why are we losing people? Because we are not seeing at preventive measures to prevent all these diseases from happening. And yes, obesity is a disease, and obesity should be treated as a disease. Initially, for anyone gaining weight, it's diet and exercise. But when your weight is going beyond your control and you are not able to get it down with diet and exercise, you need to take medical opinion and get it treated as a disease. We have a choice of treatments for obesity now. It's from, there are medication available for certain degree of weight, and there are endoscopic procedures available again for a certain degree of weight, but they are short lived. And then we have surgeries available, which are in the present scenario across the world the best way to give a big amount of weight loss. Suppose you have to lose some 40, 50 or 100 kgs weight loss, the drugs will not be able to give you that weight loss, nor the endoscopic procedures. So those are the people who should think of getting a bariatric surgery or a metabolic surgery done and get their weight under control, because if they don't get their weight under control, then definitely they will fall prey to one of the diseases which this obesity brings. Now coming to the surgical process, it is not a single surgery. There are varieties of surgeries depending upon the individual person's age, eating habits, the amount of weight, that is the body mass index, and the amount of weight they have to lose, and whether they have other metabolic problems linked to the obesity, like are they bad diabetics, are they having bad cardiac issues, are they having high blood pressure, is their cholesterol very high, or are they suffering from OSA, because OSA itself can cause right heart failure. So everything is closely linked in our system. We cannot ignore even one type of chronic disease process and then expect that the whole system will work appropriately. Now coming to the surgeries are graded according to restrictive procedures, malabsorptive procedures, and combined restrictive plus malabsorption. Most commonly we adopt a combination of restrictive and malabsorptive procedures, because that gives not only weight loss but also a maintenance of the weight loss for many years, and control of the metabolic syndrome. It prevents progression of many diseases. If you lose weight early, then you stand a less risk of developing diseases linked to obesity, like pancreatic cancers, colonic cancers, cancers of the breast in females, ovaries, uterine cancers in females. These are all directly linked to obesity. Losing weight is the best thing. What type of way you have to lose weight? Initially with diet and exercise definitely, but if you're failing that, opt for a surgical process. You may be scared of surgery, but you are not scared of taking insulin injections twice daily. So surgery is also one injection, general anesthesia, and your surgery is done. Nowadays with very good equipment, very good skill training and all, the surgeries have become very safe. Almost the risk rate is less than 1%, and we have now robotic platforms also helping us do the surgery, specifically in the super obese, where their weight becomes a big challenge for doing surgeries. But with robotic platforms, now weight is no more a challenge for the surgeon, and any type of weight irrespective of the BMI can safely undergo this surgery, lose weight and stay healthy. Always choose the medical treatment as the best option for all your medical problems, rather than going by hearsay and neglecting yourself. Thank you.
Like, comment and subscribe for more health updates.